Hi, I'm Rebecca and this is Shay. We're two of the nurses from the Townsville Hospital Endoscopy unit, and we have some important information we would like to share with you about your upcoming colonoscopy procedure with us.
This is the endoscopy unit where you will be having your procedure. Please note that if you are having a morning appointment, you will most likely be here all morning. And if you are having an afternoon appointment, you will most likely be here all afternoon.
A colonoscopy is where an endoscopist uses an instrument called a colonoscope to look at the inside lining of your large bowel. A colonoscope is a long, thin tube with a camera and light attached. This allows the endoscopist to see inside your large bowel on a video screen. It is vitally important that the colon is completely clean for the examination to be accurate and complete. A clean bowel prep allows us to see not only protruding polyps, but also flat lesions. These lesions can be harder to detect if there's fecal waste in the bowel. Now you've learned a little bit about what colonoscopy is, it's important that you know some of the risks involved in colonoscopy. And I'm going to spend a few minutes now to tell you about those. It's very important you have a clean bowel when you have colonoscopy, and we'll give you more information on that. But a clean bowel will make your test as safe as possible. It also has the benefit of making sure we don't miss things. So what are the risks? Well, the risk we're most concerned about is making a small hole in the bowel. That's called a perforation. That can sometimes happen if we're removing a warty growth called a polyp. That happens in about 1 in 1,000 colonoscopies, but the risk is probably slightly less than that. Other major risks will include bleeding, and that can happen if we remove a polyp from the bowel. Bleeding occurs in about 1 in 300 cases. There are a few other risks. They might include cardiovascular problems, particularly relating to sedation, and I guess those increase if you have more ill health such as heart disease or lung disease. We'll take this into account when we're sedating you. There is a risk that we won't see a lesion or miss a polyp. And again, if bowel prep is good, the chances of that are smaller. Other risks are fairly small, and certainly death from colonoscopy is exceedingly rare.
To make your procedure more comfortable, we're going to be giving you conscious sedation. So it is vitally important that you have someone arranged who can pick you up from your procedure and stay with you overnight, as you can't drive for 24 hours after your procedure, sign any legal documents, operate any heavy machinery, or drink alcohol. Remember, that's for a whole 24-hour period, so ask us if you need a medical certificate.
Let us show you how to make up the bowel preparation. Please follow the instruction sheet provided carefully. 2 days before your procedure, you are required to go on a low-fibre diet. This is to reduce the amount of food residue in your large bowel. During your pre-admission, you will be given a list of foods that you can eat and foods that you should avoid. If you are taking any iron tablets or bulking agents such as Metamucil, you will need to stop taking them 1 week before your procedure. If you are taking any blood thinning medication such as warfarin or clopidogrel, or any diabetic medication such as insulin or metformin, you will need to speak with your doctor or nurse, as they may need to be modified a few days before your procedure. Continue taking your regular medications unless you are given special instructions by your doctor or nurse.
Remember to tell your nurse or doctor if you suffer from constipation, as you may need to have extra bowel prep to make your procedure more thorough with a clearer bowel. The day before your procedure, you can have a low residue breakfast and a low residue lunch. After 2 p.m, you can have clear fluids only. Now, clear fluids means water, black tea, black coffee, clear apple juice, lemonade, some sports drinks, jelly, but it needs to be orange or yellow in color. So don't go for something that's red, green, purple, blue. That's not clear. And if you want to have soup, you can, but it needs to be strained, so more like a broth. So you can have chicken noodle soup, but strain the noodles and the chicken. You can't have pumpkin soup because it's not clear.
In your bowel prep kit, you will find the following items: 3 bisacodyl tablets, which are stool softeners, 1 sachet of magnesium citrate, and 1 sachet of glycoprep C. To make up the magnesium citrate solution, place about 2.5 centimeters of hot water in a tall glass. Add the contents of the sachet, wait until the effervescence settles, then fill the glass with cold water and place in the refrigerator. At 3 p.m, take the 3 bisacodyl tablets and the magnesium citrate solution. Be aware that the stool softener may make you have a bowel motion. At 4 p.m, make up the Glycoprep C solution. Measure 3 litres of water into 1 large container or 3 1-litre containers. Then add Glycoprep C powder evenly and stir well. Once this is done, place it in the refrigerator. If your appointment is scheduled for the morning, drink 2 litres of the Glycoprep C solution between the times written on your instruction sheet. If your appointment is scheduled for the afternoon, drink 1 litre of the Glycoprep C solution between the times written in your instruction sheet. Continue drinking clear fluids throughout. If your appointment is scheduled for the morning, drink 1 litre of the Glycoprep C solution between the times written in your instruction sheet. Drink a glass of water after this, then have nothing by mouth after 6:30 a.m. If your appointment is scheduled for the afternoon, drink 2 litres of the Glycoprep C solution as per your instruction sheet. Drink a glass of water after this, then have nothing by mouth after 10:30 a.m.
Make sure when you start drinking the Glycoprep that you're close to a toilet, because once you start drinking, you will have frequent loose bowel motions for the duration of your prep, and you will be needing a loo close by. Preparing your bowel for a colonoscopy is like doing the laundry. Think of day 1 as it's a wash cycle.
Your bowel return may look like these images.
The bowel prep that you take on the day of your procedure is the rinse cycle. Your bowel return should look like the last image when you've finished all of your prep.
Come to the endoscopy unit by your scheduled appointment time. Make sure you wear warm, loose, comfortable clothing. Bring hospital documents, reading material, medications if applicable, health insurance details, pension or healthcare cards if applicable. Leave any valuables at home. Please advise endoscopy if you need to reschedule or cancel your appointment ahead of time.
So thanks for watching our video, which I hope will inform you about colonoscopy, and we've covered certain areas which I hope will have educated you on the risks of colonoscopy, what exactly is a colonoscopy, and very importantly how to prepare for colonoscopy, and then some simple tips on how to make it easier. So please take all of this on board. Remember, if you've got any concerns, ask a member of staff, and I hope the procedure goes as smoothly for you as possible. Thank you.